Achukua selfie. We on now, you know yourself. Catch a groove one time, feel the vibe one time, calculate one time, two time.
The MenStar Coalition brings together 7 of the largest donors in HIV to collectively tackle our specific challenge in controlling the AIDS epidemic, that of viral suppression in men and stopping onward transmission. Like COVID-19 now, our particular difficulty has been asymptomatic young men who are infected with HIV but are invisible to the healthcare system or unknown to its providers. The virus is thus unsuppressed, quietly damaging their immune system and unknowingly infecting their sexual partners. At PEPFAR, it is our private sector partners who bring innovative thinking and approaches such as consumer marketing, human-centered design, and client segmentation to build demand for healthcare services. PEPFAR then tailors these healthcare services to scale to meet that demand.
A lot of the criticism in development is that we all sit in our fancy offices somewhere, develop these campaigns, and not really consider the voice of who we're trying to reach.
When we started MenStar, we knew we had to do something different. What's different from MenStar, it's very focused on the individual at risk.
What we wanted to do was hear directly from men. And we, in the end, heard from about 2,200 men, the way that they perceive HIV, the way that they perceive HIV treatment, and things that they think make it harder or easier to navigate that journey.
Some of the barriers that make it difficult for men to access HIV care are actually perceptions. People still think that drugs are toxic and therefore drugs will kill you before HIV does. Men, when they go to the clinic, they put on a mask. They put on this strong appearance as though they're still in control. But deep inside, they are scared to bits. If you don't receive men as a man, he will take what you give. But getting home, he will not take the treatment.
We listened to what they said and we geared everything around the man.
We created a very catchy song. We were promoting where you can get the test kit and also where you can go for pre and post test counseling. And every time the campaign was on air, you could tell from the records of the hotline, a lot of people were inquiring, especially where can I get a self-testing kit?
What we're dealing with is clinicians who are under-resourced. What we're trying to do with MENA is give them the tools that they need in order to engage with men in a friendly way. With MENA, the aim is to holistically upgrade the healthcare experience for men by providing the clinicians with support, having men-only waiting areas in the facilities, work-friendly clinic hours, as well as male-friendly clinicians. And outside of the clinic space has really changed the narrative that living with HIV is just like living with any other chronic disease. We're trying to make the healthcare experience for men better. We also have a digital platform on WhatsApp called Men Connect, powered by MENA.
Men Connect is a digital platform. It's like a buddy in your pocket on your phone. You will feel like it's a live dialogue with an actual person. Reminders about your appointments, reminders about your medication, education, information, advice. You drive the messaging.
Double Up is local slang for shortcut, giving people a shortcut to accessing their chronic medication.
It's a mechanism for stable patients to collect their medicines outside of a public healthcare facility. We need to make that as easy and efficient as possible.
For double up med stable patients would stay at the facilities waiting for their medication for up to 4 to 6 hours. But with double up meds, they're able to cut that time in half or more.
If you have any questions about how to access your chronic medicine closer to home, Uzamina Umabuta Ngipuzele Double Up Meds, a shortcut to your medication.
Double Up is shortcut. It's very convenient for me because I go exactly at a time when I need some other things like vitamins, I need some fruits, I need some veggies. I pick up those and I grab some chocolates for the kids.
Ultimately, MenStar is about meeting patients where they are and ending the HIV epidemic and getting to zero.
Sweet like mango.